Hi, it's Dr. Brian McDonough. Welcome to the Dr. Brian McDonough Show. Today, I have a medical topic. I want to talk a little bit about some of the confusion surrounding vaccines right now. What I'd like to start with is a major article in the New England Journal of Medicine. They have an extensive article, but the summary is that since 1964, the CDC has had an advisory panel called the ACIP, and that's made of leading independent scientists and physicians who made key recommendations to the CDC, which were supported by the Secretary of Health and Human Services, a government position. On June 9th, all 17 members of ACIP were terminated. The public held ACIP meetings have ceased and changes to vaccine policy are underway. Now, right now, the first moves have been made with COVID, and this was a unilateral decision. The Secretary of Health and Human Services, who's not a physician, came out and said that the COVID-19 vaccine could be a decision made by doctor and patient for pregnant women and for babies. Pregnant women and newborns are in really high-risk groups. We have the first information about the COVID-19 vaccine and if it works or not. This is another report. It recently came out, so I'm quoting the report. Well, according to research led by scientists at Stanford University, the impact was significant. Researchers looked at data from 2020, the onset of the vaccine campaign, until October of last year. According to their research, the COVID-19 vaccine prevented 2.5 million deaths in the 4-year period. Now, another way of looking at this is it saved 15 million life years. Now, not surprisingly, the highest percentage of lives saved were in the most vulnerable groups. That includes pregnant women, newborns, and those over 60. My concern is if people can't afford something, even with their best intentions, they may not get it. I've seen that with medications. I put people on medicine and they have to make a choice between food and medicine, and they feed their family. So this is a really tough situation. We have to keep an eye on it. Hopefully science and scientists will get a bigger seat at the table and they'll have an opportunity to have more of a voice. I thank you for watching. Obviously, I'm always here. I'll keep you up to date with the latest things as I learn them. And obviously, I will hit the medical journals and the science to give you as much evidence as possible. Hey, thanks for watching and stay healthy.